All right, we're here at Gold Coast Orthopedic Spine and Hand Surgery with Dr. Robert Fink, and he's going to talk about minimally invasive techniques for a rotator cuff injury. Doctor?
Rotator cuff is another problem that people come to our office when they have shoulder pain. It can be from an injury or gradual onset of pain in the shoulder in an elderly individual. The rotator cuff is a group of four muscles that form a tendinous cuff that attaches to the bone, greater tuberosity, and helps move the shoulder upward and outward. In this case, we have an x-ray of somebody that was in a car accident, hit the dashboard with the shoulder, and has an avulsion fracture of the greater tuberosity where the rotator cuff has pulled off a portion of bone. That is evident on the x-ray.
So the rotator cuff, explain exactly what the rotator cuff is. Is it a muscle?
No, it's a group of tendons formed from muscle that are joined. Four muscles attached to a tendinous cuff. It becomes tendon and attaches to the bone. In my model, it attaches right here to the bone, making the arm go up and outward. And this is a common cause of torn rotator cuff. In our x-ray, we have it's torn when there's an avulsion of the bone. Often it just tears the substance of the rotator cuff.
All right, I got a question. Hold it up. Like, where would be the front? That would be the front.
This is the front. This is the collarbone.
Okay.
This is called the acromioclavicular joint.
So the front is facing you.
Front is now facing you. I'm in the back.
Oh, all right, you're
I'm
in the back.
I'm in the back. Rotator cuff is underneath. This is the collarbone. This is the AC joint. This is the acromion. And now underneath the acromion, we have the shoulder joint, and we have the rotator cuff. A group of four muscles form a tendinous cuff that often gets torn in the cuff portion or in our x-ray off of the bone.
So what happened, like say in the car accident? Which way did the body go, and how did the shoulder joint get pulled off? Just to show us what the model.
The shoulder joint didn't get pulled off, but the body hit the dashboard, and the rotator cuff pulled off the portion of bone that we see in the x-ray.
Okay, so now once that happened, the person wouldn't be able to lift their arm upward and outward.
Correct. The most the patient would be able to lift after an injury like this would be maybe halfway. That's all they would be able to do.
So once that happened, okay, the person would not be able to move their shoulder very much, would they?
Correct.
Right,
They would only be able to move it halfway.
Right, could you show the range of motion again?
Some people will get it halfway, some people will get it less than halfway.
So in great pain, I take it.
And in great pain. Correct.
Okay, so what would you guys do then?
We would take them for outpatient surgery, where we do the operation minimally invasive. Part of it we would use an arthroscope in the shoulder. Sometimes we have to make a small incision. We would repair the rotator cuff and the bone, often with stitches, sometimes with suture anchors, sometimes with small screws.
So you basically do this minimally invasive too, just like the spine surgery, just like the heel surgery. That's what you guys are trying to do. Get people up on their feet, in action, less downtime, less pain, less scarring. Is that what I...
Correct.
All right, Dr. Fink. So with this problem, with the shoulder problem, the rotator cuff injury, how would that decrease the mobility?
Patients would not be able to move their arm in abduction and forward flexion.
Okay, that's in layman's terms.
They would not be able to move their arm very much. Maybe they'd get to their horizontal, they may not even get that much. Also going forward, they would not be able to get very much, and they would have severe pain. They may not want to move their arm at all.
Right. So, the minimally invasive technique that you guys do, which is the same as the back, minimally invasive back surgery and the heel, you also do a procedure for the shoulder like this. Am I correct?
That's correct. We use a different type of telescope. We use an arthroscope where through little holes we're able to repair the rotator cuff. Sometimes it's the mid-substance where we put stitches in the rotator cuff. Sometimes we're putting the bone back like in the x-ray with little screws.
So basically the downtime is less for this also?
Downtime is less. Once again, this is outpatient surgery. You sleep at your home. You're not going to a hospital, and you're recovering faster.
So the risk of infection is less?
The risk of infection is less.
That's great, and it's important because people right now in hospitals, there's a lot of problems with infection, and that's been a big problem lately in the news. So anytime you can get something done outside a hospital, that might not be a bad idea. So you guys do the minimally invasive spine surgery, you do the minimally invasive foot surgery and the shoulder surgery. Is that the only technique you do on the shoulder, the rotator cuff? Can you do anything else?
The rotator cuff is a common disorder. Another common disorder is just what we call impingement syndrome, where this acromion bone is impinging on the rotator cuff. The rotator cuff is not torn, but the bone is in a way sticking into the rotator cuff. And minimally invasively, we remove just some of the bone, relieving the pressure on the rotator cuff.
Is that due to bone growth as you get older, or
some people have bone spurs? You're absolutely right. That the bone spur is like a bone growth that can stick into the rotator cuff.
kind of like the heel spur, but in the joint that way?
Kind of like it.
Same principle. A little extra bone hitting the nerves, hurting us, so we want it gone, so we can go on with our day and get to our job, basically.
Correct.
Correct. Good. Is there any other surgeries you do minimally invasive on the shoulder that you can think of?
If someone has a frozen shoulder, that means they haven't moved their shoulder. The space in the shoulder gets smaller, and we would minimally invasive remove some of the scar tissue in the shoulder to get motion back.
So if they were immobile for some other reason and they really couldn't move their shoulder, that could happen to the shoulder joint, or is it just a condition of muscle atrophy? Or?
It's a condition that you don't move the shoulder, and then it becomes what we call frozen. And then often through minimally invasive techniques, we can break up scar tissue to move the shoulder.
Great. Once again, at the Gold Coast Orthopedic Spine and Hand Surgery with Dr. Robert Fink. We were talking about some of his techniques that he uses to get you back in action, back doing what you got to do quicker, better than the old way. Better than the old way, right?
Better than the old way.
Great. That's the most important thing. Same price, basically? Sometimes cheaper.
Sometimes cheaper.
Great. And most
Often,
insurance...
often cheaper because it's outpatient surgery.
Right. And most insurance agencies cover this.